So thank you, everyone. Thank you so much for joining tonight. My name is Sophie, and I work at the Institute of Global Health Innovation as Operation Officer. And I also run the Julia Anderson training program. I'm joined tonight by Alice and Inaya, who were part of our sixth cohort of Julia Anderson trainees, and also by Tatiana, who is a research associate at our institute, and she leads on one of the trainee roles. Hopefully, we will also be joined by Simon, but I think he's in another meeting at the moment, who will be sharing more information about the behavioral science role. We're also recording the webinar in case you want to look at it later. And if you have any questions, at the bottom of the screen, you will see Q&A. You can ask any questions that you may have at the bottom in the Q&A, and we will answer them throughout and at the end as well. Next slide, please. Oh, we also got Eleni, who you can't see, but she's very kindly navigating the slides for us. So just to give you an overview of what you may expect tonight, so we will give you a little bit of info about our institute. We will also talk about the application process and also about the two available roles. And you will hear from our trainees about their experience and their application tips. And at the end, we will answer any questions that you may still have. Next slide, please. So just to briefly talk with you about our institute and the training program. Next slide, please. So we are an institute at Imperial College. Our institute works towards better, safer, and more equitable healthcare. So we comprise of a few centers: the Climate Care Center, Helix Center, which works on design, the Fleming Initiative, which works on AMR, the Center for Health Policy, Hamlin Center for Robotic Surgery, and our Patient Safety Research Collaboration. Next slide, please. If you want to read more about the work that we do, you can go to our website. I will post the link in the chat later on and read our annual report. Next slide. So just very briefly about a training program. So we set up the training program a couple of years ago with the aim of providing paid work experiences for those with limited or no prior work experience. Our program wants to address underrepresentation of certain groups in academia, and we run an anonymous application and a supportive recruiting process. Next slide, please. So what can you expect? So you will get a contract of 12 weeks, which will also include 6.5 days of paid annual leave. The salary is £28,627 per annum for a full-time contract. You'll get mentorship, and at the end of your program, you can request references as well. Next slide. So where you will be based, the training program has a hybrid working setup, which means you'll be working 3 days in the office and 2 days from home, and which days you work from home or in the office are in agreement with your line manager. Next slide, please. So I will very briefly talk about the application process and what you can expect. So it's an online application form, which will be anonymized. So you don't need to submit CVs. It's just answering 3 brief questions around your reasoning for applying and your skill set. You will have time until the 6th of October, 1 minute before midnight, to apply. Please note we can't accept late applications, so please bear in mind that there can always be a technical issue. Something can go wrong, so please don't leave it to the last minute because we can't accept late applications. It's also an opportunity for you to get feedback. We provide feedback to everyone who asks after the application. Next slide. So I wanted to talk with you about eligibility. Our training program is only open to those aged 18 and above. For the behavioral science trainee, anyone can apply that has a minimum of A levels. For digital health trainee, you need to have a minimum of an undergrad degree already. We also request that you have less than 2 months prior work experience in health, science, technology, or business management. So under business management, we understand any role which is related to administration, marketing, communications, consulting. If you're based in an office, it's labeled as business management. You also need to have less than 2 months paid experience or unpaid as an intern or a training program. We do accept volunteering experience and placements that were part of a course. We don't accept applications from those studying or graduated with a degree in medicine or dentistry, nor from PhD students. We don't have minimum grade requirements. And also you need to carefully look at the essential criteria on each job description of the role, which you will need to meet as well. And you need to have the right to work in the UK. Unfortunately, we can't provide visa sponsorship. I will also post a link to the eligibility criteria in the chat. I have added one slide with more information about our eligibility criteria and questions that you may have. As well, you can apply for more than one post. You're very welcome, as long as you meet the essential requirements for both roles, to apply for both roles. International students are very welcome to apply. If you have only 20 hours that you can work, we can discuss your hours at an interview. We can't provide visas, unfortunately. And then I have also added some specific examples of work experience, which you can, when I share the recording, which you can look into. Next slide, please. So I wanted to add some application tips from myself. First of all is ChatGPT. I think many people feel more comfortable in getting help from ChatGPT or another bot to write their application, which I understand as well. But we want to see a bit of personality. And if we receive 50 applications for one role, and they're all written by ChatGPT, it's very hard to see how you are unique. So try and add like something personal and try to add something about yourself as well. Don't just copy and paste. Also, this is an opportunity for you to get feedback. So we rather see an application that is written by you that we can like give some feedback on than just a box standard ChatGPT application. Really read the job description, showcase that you've got an understanding of the role and the training program as a whole. There's one question at the end of the application, which I also share a little bit about you. So really use the opportunity to showcase what makes you unique, and stand out. And also very carefully read through the essential criteria and showcase how you meet them. So those are my tips from after shortlisting for 8 cohorts. Next slide, please. Okay, and now I will pass on to Tatiana, and yeah, do feel free if you've got any questions at this point to add them in the Q&A at the bottom. Tatiana.
Hi, everyone. Nice to see so many people joining today. My name is Tatiana. I'm a postdoctoral researcher working within Theme 4 that sits within NIHR Patient Safety Research Collaboration. And next slide, please. So our theme is led by Professor Ara Darcy and Dr. Ana Luisa Neves. And we are evaluating so our theme is basically focusing on evaluating and integrating patient safety in the design of new service delivery models. So in simple words, what we do, we investigate the safety of digital care models, such as virtual consultations. And currently we are focusing on virtual care specifically. We're trying to deliver a set of patient safety indicators that could be applied to assess the safety of virtual consultations across primary care setting in the UK. Next slide, please. So there are also several other projects that are quite exciting as well. We have two research fellows working on exciting themes such as investigating the safety of AI models in primary care, and there is another research theme looking into surgical hubs and how they foster the equality in and safety in surgical patients. So there is a lot of room for exciting activities for you to get engaged in various types of work. And we would be very happy to provide you with experience that you need and make sure that it's tailored to your needs and to your future objectives, career objectives, professional objectives. So who we are looking for in this particular role. So as Sophie mentioned, we'll be looking to recruit people with undergraduate degree in healthcare, public health, or any other relevant discipline. We would welcome applications and applicants with MSc in public health and PH, but this is not an essential criteria. So you should have experience working in teams, collaborating with people, working as a part of a wider team. It would be great if you had an understanding or at least an interest in the principles of patient safety in digital health. And if you had an understanding or an interest in how to conduct research data analysis, either qualitative or quantitative. Obviously, we don't expect a proficiency and proficient knowledge and skills in data analysis. This is what you can actually learn while being in your placement, but some understanding and interest in learning will be welcomed. So again, experience or interest in collaborating with others, developing your communication, team working skills, and it is essential that you had an experience of academic writing, at least from essays during your degree. If you had any publications, this would be great, but this is not essential. So any experience of academic writing. Next slide, please. So some tips to succeed. Well, first of all, I think it's very important for you to do some self-reflection and sit and think, are you interested in research and academia? Because this is a research setting. Is this a right opportunity for you? So just reread the call for applications and see if this is something that aligns with your with your future career goals. So have a think about what skills or life experience make you special. So as Sophie mentioned, just don't copy and paste from ChatGPT, because we want to see you as a person and who is behind this application. So think about what you expect to get and learn in this program, and there will be only 3 months, and I think it is important for you to have a vision of what you want to achieve and what milestones you want to achieve, so that we could help you to do that. Feel free to share your ideas with us. We would welcome any new project ideas, any suggestions about approaches, activities. And yeah, just be yourself, have a positive attitude, and good luck with your applications, guys. Thank you.
Thanks, Tatiana. Simon?
Hi, all. Thanks so much for the opportunity to present to you about the work going on in the Fleming Initiative. I'm not Kate Grady. Kate is one of our team that has gone off to the UN General Assembly to represent us there. The UNGA this year is centered on antimicrobial resistance, so it's a very exciting time for us. Do you want to go to the next slide, please? So antimicrobial resistance, I'm sure many of you, so just about a little bit about the Fleming Initiative as a start. It is the latest and greatest thing to come out of the IGHI. It's our major project at the moment. The Fleming Initiative is focused on antimicrobial resistance. So antimicrobial resistance is when antibiotics stop working against bacteria or other infectious diseases. It is actually a massive problem already and growing. And it's also a very interesting problem and one that is well suited to the Institute of Global Health Innovation in that it's a very multifaceted problem. It's not just about science to deliver new antibiotics, but actually cross-cutting with policy to try build an environment that keeps this going and public engagement. But what you would potentially be joining our team with is in the behavioral science unit. Do you want to go on to the next slide, please? So behavioral science, for those of you that are not aware, is that at least in the framework of antimicrobial resistance, there's no point in us developing new antibiotics and people are going to continue using them in the same way. There's no point in people understanding about the risks of the antibiotics if they don't change their behaviors. So behavioral science is very much a science-driven approach whereby we try influence the way people approach a problem like antimicrobial resistance and try instill better behaviors in them to change the problem, to be a solution to the problem. So the behavioral science is one of the 4 key pillars of the Fleming Initiative, along with clinical sciences, policy, and public engagement. And it's an area that the Fleming Initiative has already had quite a lot of success. We've recently had our first paper published looking at the way, just the naming of antimicrobial resistance and how to create a better understanding in people so that they can change their behaviors. It's very much a science that is a matter of kind of co-development whereby we work closely with stakeholders such as public, such as clinicians and things like that to try to find out why they are, where the behaviors stem from and how we can best influence these. Next slide, please. So Kate, who is the lead behavioral science lead, who's the one that's at UNGA, has really got a very strong program going on behavioral sciences on AMR, with projects ranging from understanding how AMR is perceived in stakeholders, as well as behaviors such as respiratory hygiene, hand hygiene, things like that, the use of antimicrobials. And one that's I think quite exciting is the understanding of use of diagnostics and their kind of, how to nudge people towards understanding their health conditions rather than just reaching for antibiotics, which is kind of how the problem has developed. Kate's got a very exciting program, and she's going to be working very closely with whoever's successful in their application to develop a project of their own. But this is the type of projects they'll be working on. Do you want to go to the next slide, please? So the one that's, I think, the lead contender at this point is we're also aware of the fact that people actually don't use antibiotics in the way they're supposed to. They tend to, and that's at no fault of the patient and the public, but it's actually something that crosses disciplines from the prescribers to the way they understood to farm. And So this is a kind of a cross-cutting project that will understand why people, how and why people use antibiotics, and specifically how people use them or discontinue using them and discard them, and trying to understand the best ways to change behavior around that. So it's going to be a process of kind of understanding and then developing an intervention and then testing this in a kind of a science-driven way. It's a fascinating specialty in that you'll be learning kind of quite diverse disciplines, from interviews towards literature reviews, patient engagement, stakeholder engagement, intervention design, which is fascinating, and really importantly, how to assess whether an intervention is working and to influence behaviors. Along with that, being in the setting we'll be at, the outputs will probably be in the form of kind of academic skills, presentations, potentially journal articles, so really valuable skills for kind of aspiring academics. Next slide, please. I would say the real benefit to joining this project is the team you'll be working with. It's a really multidisciplinary team with who are quite, in my very biased opinion, some of the best at what they do. We've really had incredible impact in quite a short time in the field of AMR. But they work very closely with our design center at Helix. They work very closely with our policy team. So it's the type of project where you won't be constrained to just one area, but actually get to work across a lot of things. You'll be working with and learning from incredibly talented professionals in the fields of like qualitative research, quantitative research, skills writing, design, and things like that. So you'll learn a great deal joining us. Next slide. So I think the most important thing that Kate and the team are looking for is a person that's going to be as excited about the project and program as they are. So being interested in behavioral science and AMR and developing solutions that can think outside the box and really change the health landscape. So people. Forgive me.
Simon, yeah, I think the baby wanted to say hello, probably.
Yeah, my daughter, everyone. So yeah, be interested in changing the health landscape, learning a lot, and building a kind of a world free from AMR. I think that's my last slide, if I'm not mistaken.
Yes, thank you, and hello, baby. We will now pass on to Alice and Inaya, who will share their experience as a trainee.
Next slide, please. Hi, everyone. So I'm Inaya. I am from Singapore, and I go to UCL doing psychology. I was the public involvement trainee at IGHI this summer for the last 12 weeks. And yeah, Alice.
Next slide, please. Thank you. Hi, I'm Alice. I'm a third-year psychology student at the University of Bath, and I just finished my traineeship on Friday as the educational research trainee. Next slide, please.
So we thought we'd talk about what we've been working on over the summer. My project was mostly with Mental Health Innovations, which is a charity that runs a 24/7 text helpline service called Shout. And so part of that project was trying to improve Shout services for children aged 10 to 13. And we did a deep dive on their mental health and barriers to accessing mental health. So my work included doing things like writing lay summaries, creating participant information sheets, and then converting that to a child-friendly video, so it was easier to understand for them, and then building the actual survey that we are going to send out to the children, and then an ethics application that we had to submit to Imperial. But because of that ethics application, there was a few weeks of waiting for that to go through. So I got to work on other projects. I wrote some blog posts and did some communications work, and did some scoping reviews and research. And then I also went to Southampton for a 2-day public involvement course, which was quite interesting to be able to learn the theory behind the work that I was doing. And then we also did some recruiting and started working on a public involvement front door, which is like a resource for researchers to understand what public involvement is. So it was quite a mix of different things.
So unlike Anaya, I really focused on one project. I was researching the intersection between problem-based learning, which is a specific learning style, and dissertations of practice, which are used in a couple of the master's degrees that the institute provides. And so I really followed a research process. So I started with a scoping review of all the literature that was already out there. And then I followed on doing appreciative inquiry interviews. So I helped develop the interview schedule. I did research all about appreciative inquiry to make sure it was really understood and we had a solid foundation. I looked up experts in the area to make sure we were interviewing the right people. And then I conducted the interviews alongside my line managers. And then moving on from that, I transcribed the interviews and conducted a thematic analysis. And from that, I triangulated the themes that came out of the thematic analysis and the themes that came out of the scoping review to provide recommendations for the implementation of dissertations of practice by the institute. And then moving forward, they're now looking to take this into a deeper research and continue to do further research based on what we found out of this initial pilot project. Next slide, please.
So we thought it might be interesting for you to understand what a working day or week kind of looked like for us. So I guess in an overview, for me, this was a few weeks ago when Alice and I were putting these slides together. And so I work at the Helix Center, which is one of the parts of IGHI. And so we have a weekly hello call every Monday morning. And then other things I was doing that week was shortlisting applicants for a particular group that we were recruiting for. So I blocked out some time to do that and speak to public members on the phone. And then I had different intro chats with different people. So another opportunity that you get at IGHI is to connect with other colleagues at IGHI, and often they have connections to other people, which were really helpful for me. So I talked to Ariel, who is a clinical psychologist who works for mental health innovations, on the Tuesday morning that week. And then we had an all staff on Wednesday, which was just presenting the work that we've done over the last few months. And then a pre-event briefing for an event we were organizing. So it's been quite a mix of different things. Next slide, please.
My days were not as chock-a-block with loads of different things as that. They were variable depending on the stage of the project I was in. But it involved both a lot of teamwork, so communication with my line managers, and also independent work. So my line managers really allowed me to take lead on the project and just supported me through completing it. And so part of that was just me managing my own time and making sure I was meeting all the deadlines that were necessary. And so I was very much in control of what my days looked like. And again, as Anaya said, alongside that, I think an important thing I would highlight was it's very important to connect with your team and network with your team. That's really where a lot of my scheduled activities came in, because it's not only just connecting with your immediate team, but as Anaya said, they're connecting you with other people they know, really aligned to your interests. So that was also very much what I worked on. Yeah, next slide, please.
So in terms of application tips, I guess we thought we'd do this together. My main tip would be to consider the job description and the essential and desirable criteria. What I did was go through that and then on a separate document, like write it down in my own words. When I was writing my application, I kept looking back at what they wanted, and tailoring my experience or skills to points from the job description, and demonstrating passion, you should be genuinely interested in the project that you're applying for. And similarly to what Sophie said, not using ChatGPT to write it for you, and trying to demonstrate passion and talk about your skills and experiences as much as possible.
Amazing. Thank you so much. I thought that was really, that was really great to hear as well, also about your experience. So thank you for sharing. Alice and Inaya, I had one question in the Q&A about your LinkedIn profile. So if you are willing or happy to share that, you can share it in the chat if people want to reach out for questions. We've got a few questions in the Q&A, which I think will be helpful to answer live. The first question actually exists out of 5 questions. So I will take them one by one. I think, Tatiana, the first couple of questions are probably for you. First question, is practical experience conducting a systematic review a requirement, or rather just knowledge of how one would go about conducting one acceptable also?
Well, generally, yes, because we don't expect you to have published a systematic review. So knowledge of the methodology would be enough, and obviously interest to learn. And I think, yeah, that would be enough.
Okay. Second question, regarding our experience of qualitative research methods, is this referring to conducting interviews, for example, or rather the analysis itself, i.e. conducting thematic analysis on qualitative data?
So again, experience in interviews would be welcomed, and ideally we would expect at least some knowledge in the methodology or of how to do the qualitative analysis. But again, we do understand that at your level, it's not essential. So just familiarity with the methodology, willingness to learn.
Okay, thank you. If our background is in public health, but we're not specialized in digital public health, would you say that the role is still accessible?
That's completely fine. Yeah.
Okay. So I'm just trying to get through all the questions.
I myself don't have MPH or masters in digital health. It's just general masters in public health. So yeah, no problem.
And you're
at
doing
all.
an amazing job. So so next question is more about the training program. What have previous trainees gone on to do after the 12-week program? We've had around 19 so far, so it's all very different, and it all depends on where they are at the stages of their life. So we've had one that's moved into a research assistant role. We've got one that's gone on to do clinical trials coordinator. Some have gone back to university. So there's very different ones. We also have a few trainees that are still involved with the work that IGHI does on a casual basis. Do we require references for application? Yes, you will need 2 references. One can be from a tutor or a professor in school, and then the other one can either be from a relative if you've never worked before or never done any volunteering. So I will go to the next question. I think Tatiana is for you as well. But I think the answer will be the same. I have a master's in digital health. Would this be applicable rather than public health?
Of course, yeah.
Yeah.
Masters in digital health, super specific. Yeah, of course. But that's not a must, you know, so we're very flexible. If you have masters, that's already very good. So, yeah.
Got a few questions about how many people are accepted, how many trainees. So usually we've got 3 roles and then we make a cohort of 3. This time around we have 2 roles, which means technically we will take on 2 trainees. But in the past, when we had 2 roles, we've taken on 3 trainees. 2 people were international students working 20 hours, so 2 worked on 1 role. So that could be between 2 or 3, depending on how many amazing candidates we get. About the application, if I apply for both roles, will each application be considered separately, or will they be assessed together? No, each application is considered separately because the 2 roles are 2 separate roles. So the shortlisting panel for the 2 roles are completely different. Also, all applications are anonymous, so we can't see, you'll get assigned a unique application number per application that you do, so we can't see if you have applied for 1 role or more. Someone is asking about opportunities available on completion of the program, if there's opportunities. So we can't say that beforehand if there's any jobs that are going to become available, but obviously you have access to the Imperial Jobs website. I also provide mentoring to trainees, so if there's any opportunities, I'll send them your way. And Inaya, for example, can comment on her experience.
Yeah, sure. So I did the 12 weeks. And as I was saying earlier, the project I was working on was kind of put on pause because of the ethics application. So now I'm going into my 3rd year of uni, but I'm working 1.5 days a week at IGHI on the mental health and patients project specifically. So there has been an opportunity to stay on for me.
Amazing. Someone said Daniel mentioned a recent publication. I'm not sure who Daniel is or who mentioned a recent publication. Was it Simon, maybe? Simon, are you still here? Or are you busy with baby, perhaps? I think it might have been Simon who shared the publication. I will, if he's back, I will ask him to post a link in the chat if that's possible. If there's no prior experience with a pharmacology degree, yes, you would be acceptable. You would be accepted, sorry. So we've got one question. I'm not sure if it's for you, Tatiana, or for the other role, but perhaps because I don't know if Simon's here, you can answer. Are there any specific methodologies or tools for qualitative analysis that the team primarily uses / would be an advantage to have?
So in our team, we're using NVivo, and if you had any experience with NVivo, that would be great. Some people just use Microsoft Excel really and do the coding in Microsoft Excel. But we're using NVivo. It makes our life much easier, and there is a lot of resources on the internet, YouTube videos, anything. And any reading that you could have, please do if you're interested in the role. This could be very, very helpful.
Thank you.
Also, there is so NVivo is accessible on our Imperial platform. It's free to use, so you can just download it on your laptop and start working.
Thank you. And yes, it was Simon apparently about the publication. No worries. Once he's back, but he might have run off with the baby. I can ask him. Could we include our final university project for experience if it's relevant for qualitative analysis? Yes, you can. We just request you don't mention your university because we're running a non-biased process, so don't mention any names of universities. Application to interview ratio is a question that we get asked quite a lot, and usually I don't like answering because it's just a number of applicants. It's really difficult to say, like, for example, we can get 200 applications, but only 20 would be great. And we would take forward 6, or we would have 10 applications in total, but 9 would be great. So it's a really difficult question to answer. Don't hesitate to apply. I give personalized feedback to everyone who asks. And yeah, hopefully that is very helpful. The interviews are virtual, yes, and there's only one interview. There is also an interview webinar, so if you go through to the next round, then sorry, I'm just trying to get through all the questions. If you go through to the next round, we also run an interview webinar. There is a tentative timeline for the recruitment process on our website. So I have linked the website of the training program in the chat, and under more detail, you can find the entire application process there. Jobs will close by the 6th of October. We will aim to shortlist by early November, and interviews will take place in November. But for the detailed timeline, you can find it on our website. So to ask for feedback, you can send me an email, but once you apply, you will get the information from HR, and then you can just ask them and they will pass it on, which should be straightforward. A compulsory national youth service would not count against eligibility. You're still welcome to apply. A previous job in retail means you're not ineligible, so you can still apply. Retail is fine. I will try to get through all the questions, but we might also start wrapping up in a second. I will post, if someone can kindly post my email address in the chat, that would be really helpful, and then you can always email me as well. We assess applications at the end, so we do not assess applications on a rolling basis. We wait until the 7th October to answer questions. A PG diploma would be eligible. I think for the behavioral science role, yes. I'm not sure, Tatiana, for your role.
I'm sorry, can you repeat what kind of diploma?
It's like a PG dip, I'm assuming. It's like postgraduate diploma.
Is it a university degree?
I don't know. They will need to answer that.
University. If it's a university degree, then yes.
Okay, thank you.
But if you have a bachelor's degree and some kind of postgraduate training, this will also be eligible. So as we mentioned, master's is not a must. It's a desirable criteria, but it's not an essential criteria. So it's essential that you have bachelor's.
Thank you. So I have a lot of questions on eligibility. I'm afraid I can't comment on all of them individually. So what I would suggest is, in the first place, look at our website, which I have posted in the chat, because you will find very detailed information there. For example, administration roles longer than 2 months are not eligible. The slides will be shared, I'm hoping, and this recording as well. And I'm hoping that will be shared after, well, hopefully tomorrow or the day after. Yes, BSc Physiology will be legible. So supporter accommodations for people who are disabled or neurodivergent, you can write me an email as well. And I think we will then probably have answered most of the questions. I can't take on all the eligibility ones, but do check out our website, because that should have plenty of information. We can't unfortunately provide for relocation allowance. We can only provide a salary, and for travel either. So we just provide the salary, and we allow working from home for 2 days, which should hopefully also help with the travel. Work experience outside UK also is considered towards the eligibility. So it's anywhere you've worked before. So which role would you say is more tech focused? I think that's a hard one. I think the one with Tatiana, probably. So the salary range, as I mentioned, for both roles, the salary range is the same. So it's around 28k per year. So I think we're going to start wrapping up now. I've seen a couple of questions about internships for summer. So you do run 2 cohorts per year. So we will probably be starting recruiting in March 25 for our summer cohort for 25. I don't know yet which jobs they will be, but we will. You can keep an eye on our website where they are published, or you can always send an email. And you need references for both roles. So both roles are part of the training program, and both roles require references. So I think we're going to wrap up now. If you have any questions, please check out our website, or do send me an email. And yeah, wishing you all the best with your application, and look forward to receiving your applications. Thank you very much.